okay? So here's the way the process went. We had a 3-hour drive to Lubbock, Texas, where I was getting the surgery done at Covenant Surgical Hospital under the direction of Lubbock Sports Medicine, Dr. David Shepard and his staff. So we got there a day early. They had an orientation that was wonderful. Everybody that was having surgery the next day, which I was surprised, it was a room full of people. And a nurse came in and went over everything with us. Here's these soap. Wash with this soap the night before. Follow the directions. You got to scrub down and stand there for a little while, scrub down again, trying to kill bacteria. Here's a drink. Drink this drink 2 hours, or I don't remember the exact hours, some number of hours before your surgery. So I had to set an alarm and get up like way early to drink this drink. It wasn't like a Red Bull or anything, but it's some kind of energy, sugary thing to help your body deal with the fact that you're fixing to lose a lot of blood. Then we went early in the morning to the hospital. In the hospital room, I had to go into the bathroom and take these antibacterial wipes and scrub down my whole body. Then they came in, gave me a haircut, the anterior approach. And then the surgeon, Dr. Shepard, came in and we had a discussion about, yes, I am having a hip surgery. It is this hip. To make sure we got the right thing. He even autographed it. And then they gave me something to dope me up. You can see by the droopy eyelids and the grin on my face that it was pretty good stuff. I remember that all very well. I remember being wheeled into the operating room where I got to see an astounding number of people. I was surprised. And lots of stainless steel shiny instruments. Most of them sharp and pointy looking. Scalpels. What looked like pry bars, I'm sure that's not the right term. Retraction tools, perhaps. Drill, saws, hammers. Not a claw hammer, but like a mallet, you know what I mean? Which I'm a biologist. I thought that was all really neat and fascinating. Some of you may find that disconcerting, but it's okay. Those people know what they're doing. So anyway, and then another guy came in and said, hey, I'm an anesthesiologist, so I'm going to give you a little something. And that's the last thing I remember. So I wake up, I do not recover well. I wouldn't say combative, but I would certainly say disagreeable. Got through all that okay. I did have a problem with my IV. When they set it up, it was hanging out past my knuckles. And I snagged that thing on the bed. When I went to the bathroom, on the walker, I snagged it all over the place. And I did it enough times that it created a clot in that vein. And then the next day when we were about to check out, they came to give me a shot of something. I don't know what. They shot stuff in there all the time. Oh, it hurt so bad. And another nurse came by later and went, oh, you've got a huge blood clot. They shot some stuff they called some super anti-inflammatory stuff in there, and I had to wear a wristband that told any other hospital if I was in a car accident or whatever, had to get rushed somewhere. This wristband that said, this guy has had all this anti-inflammatory shot in his hip, don't give him any more. So anyway, I had surgery that morning. They got me up that afternoon and we walked up and down the hall for the first time. And I've had a lot of people go, oh, so as soon as I got up and I walked, it felt so much better. You know what? I still hurt. I mean, just in different places. So had surgery one morning, spent the whole day there, walked that afternoon, and walked again that evening.
All right.
I had a horrible night at the hospital. I was in pain. I couldn't find any way to lay that didn't hurt. I got chewed out for going to the bathroom unassisted. I was attached to all this stuff and monitors, and I snagged that dang IV on everything. But got through it. The next morning, they wheeled me off for physical therapy, and a wonderful therapist went through all the little stuff, like how to get in and out of the car, how to get in and out of bed, how to get in the shower, how to wash your feet, etc. She was fabulous.
So that first morning, we just did physical therapy, really simple stuff like, raise your leg and, do little squatty things, little stuff like that. And then I took a really good full dose of pain meds and then got in the car with Mindy. She drove me home 3 hours with lots of pillows. We made one stop along the way.
When we got home, everything was ready to go, which is so important, as I described in part 1. And if you haven't, please go watch part 1. Now, I'm going to share my recovery mostly chronologically, but first I want to show a few things where quick time lapse is important. Then I'll get back to the chronological recovery. Now, I want you to see the incisions, and let's start with the robot. This is about the only thing they didn't inform me about real well. She just said, when you wake up, you'll have 3 little sutures on the opposite side. That's just to help guide the robot. Well, it turns out that they drill 3 bolts into the top of your pelvic bone so that the robot will always know the exact position of the pelvic bone, which is really important in proper placement of the cup into the hip socket. Let's hear briefly from Dr. David Shepard about that.
The robot actually helps us to align this implant right here. That's what it does. It helps us solve the 3D puzzle. This has to be in a very specific position. And we don't want it to be in like this, and we don't want it to be in like this.
Right.
Those are exaggerations. But it matters where this piece is to the overall stability of whether or not this is going to pop out of socket. That's probably the one most important thing. Okay. So we map the bone. We use a CAT scan. We decide exactly where we want that to be, and then we input that, and the computer helps guide that location.
Okay,
So,
outstanding.
Sort of a GPS.
Millimeters matter.
Millimeters matter. And degrees. Millimeters and degrees.
Here it is without the bandage on day 5. Bruised and all, but the incisions themselves look good in that they're not red, swollen, or leaking goo. Now, the primary incision was another story. Here on day 2, everything was looking pretty scary. By day 4 or 5, the wound had ceased bleeding into the bandage, and the bandage was not saturated, rather just had a few spots. Underneath the bandage, the wound looked good. Not red, swollen areas, and no leaking goo. Although my leg was a lovely yellow, pink, and orange, kind of like the sunsets of the Great Plains. We got it all cleaned up, recoated in iodine, and a fresh bandage. Then a few days later, I was greeted with a green dot on my bandage. This was a bit disconcerting. Upon removal of said bandage, we found this. All I know about gangrene is what I've seen in war movies and on westerns. And the first thought in my head,
my bandages are leaking.
I called the emergency number for Lubbock Sports Medicine, got the answering service as it was New Year's Eve. I immediately began complaining to my wife, Mindy, that would probably be a day or longer before I heard back, and within 1 minute, the phone rang. The doctor on call gave me his email address and requested photos of the incision. He quickly called back and said not to worry, that it was some kind of chemical reaction. To clean the wound, reapply the iodine, and keep my appointment for the upcoming staple removal in Lubbock, which we did, and all was fine. We got staples pulled on day 15, and my leg that was once purple and then yellow is now back to its normal color. Another, quote, complication, end quote, was that on day 2, I experienced this rapid swelling. And I know it was my fault. I had my first day of physical therapy that morning, and I didn't listen to my physical therapist, and I did too much, tried too hard, even after repeating back to him the rules.
So, you know the rules.
Don't do too much. Do what you tell me to do, no more, no less.
Good.
And I overdid, and later that morning, my legs started swelling up. And what can I say? I unfortunately live from the mindset of, if some is good, more must be better. And that's just not true. Not just in surgery and physical therapy, and a lot of other things in life. But anyway, I marked the swelling with a pen because I thought, man, that's growing fast. And if it's actually going as fast as I think it is, I want to be able to monitor it. And sure enough, so here's the time-lapse photos. And you can see how quick it swells. Well, I'm freaking out, so I called the doctor's office. And they said wrap it in what they called a compression bandage, which is just an elastic ACE bandage. I wrapped it real tight. They said elevate it, stay off of it, don't do anything for a while. And sure enough, I did that, and it quit swelling up, and it gradually went away. So here are the things they wanted me doing at home, their discharge instructions, and their communication was wonderful. The information they provided was wonderful. So they had me taking this Norco stuff, which is just a mix of hydrocodone and acetaminophen. And I took around 1 every 4 to 6 hours during the day. I would take 2 if I wanted to get some sleep. And it works well. Now hydrocodone, you got to treat it kind of like a snake. Snakes are okay, if they're out controlling rodents doing their thing, but that doesn't mean you want one in the house or wearing it around your neck. So proceed with caution. I will say it was very effective. I took it for probably a little less than a week because then I didn't need it. So, but you do what works for you. And remember, you don't get a medal for being the first one who got off of pain meds. And you're not going to get a certificate of toughness if you quit taking it. You just endure through the pain. There's no reason to do that, okay? Because this is a major trauma. It's okay if you take some meds to help yourself get through it, especially if it's to help you get sleep, okay? I was also taking aspirin. That was to keep my blood thinned out to reduce the risk of blood clots or deep thrombosis or something. We'll look at that here in a second. And also a stool softener, which is just an attempt to address the side effects of the hydrocodone. So one way they fought off these blood clots in your legs was to do foot pumps. Pump my feet 10 times every hour. Now, hydrocodone also makes your breathing pretty shallow. So they had me doing this thing, breathing through, called an incentive spirometer. So we got this little thing. We'll give this a quick go. So you want the little green, that little green thing right there to stay in the happy face zone. If it goes too high, you're inhaling too fast. If it stays there, you're inhaling too slow. And this little line is your objective. Gotta hold it till it gets to the bottom. And then exhale through pursed lips. Do that 10 times, once every hour. The dressing was waterproof. You could shower, but you couldn't soak in the tub. The nurse at the orientation suggested also wrapping it in press and seal, which I tried, and to me, it just made it pond up. She had said it worked good. It might be because she's shaped like an hourglass and I'm shaped like a barrel. And so that didn't work for me. I only did it once and quit. They're worried about infection, obviously, so they were told to keep an eye on it and the things to look for. All right, and so watching out for blood clots in the calves, pain in the calves or swelling, a deep thrombosis that can break loose, cause a pulmonary embolism and basically block your lungs. And so that's when you call 911, and that knowledge is a good reminder to always do your foot pumps. I thought it'd be good for you to see how difficult it is to get dressed. And this is on day 7, so you can imagine how bad it was the previous days. And I also wanted you to see how important these little tools are. And this came in a hip kit I think my wife got at a pharmacy somewhere. I also want to point out these compression stockings that I had to wear for 4 weeks. I also took aspirin for 4 weeks in an attempt to reduce the chance of blood clots. And I did have to incorporate the help of Mindy to get those stockings off and on because they fit really snug. And this little sock putting on tool is so handy, it was fabulous. I don't know who invented that, but I hope they own a big ranch somewhere. And I do hope you'll go on and watch part 3 of this series, and so you'll get to witness these types of processes getting so much easier. And that's even in just 1 week from when this was filmed. And none of these tools will be needed. I also want to point out the importance of get the long shoehorn. The last thing I want to talk about here in part 2 is the importance of getting up and walking regularly. The hospital and the doctor's office stressed getting up and walking at least once every hour. And it doesn't have to be far, just a lap or 2 inside the house. But the importance is the regularity of it. And what I found was the longer I sat without walking, the more it hurt when I got up and started walking. All right, that's it for part 2. Now, I hope you'll hang around for part 3. I'm going to go over the physical therapy, and you'll be so hopeful in watching that recovery, watching how much better I get, especially compared to what you just witnessed here in part 2. But trust me, it gets better.